Here for HSC 114 Medical Terminology. We are talking about the Language of Medicine 12th edition by Davy Ellen Chapner, and we are now on week 7 talking about the cardiovascular system. And so if you are looking at your book, this is chapter 11. If you are looking at your syllabus, we are talking about objective 9.7.1 through 9.7.7. Alrighty, so let's get at it. What are we doing? The cardiovascular system, we'll talk about the parts of the heart and the blood vessels, how blood circulates. We'll trace the pathway of blood through the heart, talk about what can go wrong with the heart and blood vessels. And I want to pause here for a moment to let you know we actually will cover chapter 13, which is the blood system, in a few more weeks. And that's a little bit different than the heart and the fact that blood is flowing through the heart. You will also notice in this chapter we will start talking a little bit about the respiratory system, because the cardiovascular and the respiratory systems are so intertwined. So it makes sense that this week we talk about cardiovascular, next week we talk about respiratory, and the two are pretty well linked. All right, so we will go over combining forms. We will talk lab tests and clinical procedures and abbreviations. As always, we want to make sure that we understand medical terms in their proper context. All right, what is the cardiovascular system and what does it do? It is all about the heart and the blood vessels. They deliver oxygen and nutrients to the cells of body tissue. The heart itself is a muscular pump, and the blood vessels act as fuel line and transportation network. So let's get to it. All right, arteries are the vessels that lead away from the heart. So think arteries are going away. Veins have thinner walls than arteries, and they move the deoxygenated blood, the blood that has given away its oxygen in those little tiny capillaries. Now they take that blood back toward the heart. So it needs to go back through the heart, to get pumped through the heart, to go to the lungs, and then out to the body. All right, so here we go. And actually it comes back through the heart again before it gets pumped out to the body. But anyway, long story short, arteries have thicker walls than veins. Arteries typically carry blood away from the heart. Veins carry it toward the heart. And capillaries are the smallest vessels. They are the point at which that exchange happens, where oxygen and nutrients go into body cells and waste products are brought out of the cells and put into the blood that then flows in the veins back toward the heart. And here's a cross section of each one so you can kind of see what they are and what they do. And here is an actual picture of the system. So we're going to start with number 1 down here, and that's your right side of your heart. The vena cava is bringing that deoxygenated blood, right, back to the heart. All right, so what happens next? It goes through the right side of the heart and it goes out the pulmonary artery. It's going to go out through there, out through this pulmonary artery, over into the lungs. It goes either way because it goes through both lungs. Once it's in the lungs, it's going to pick up the oxygen, get rid of the carbon dioxide. Because remember, our lungs breathe carbon dioxide out. And that's how that gets away and gets released from our body. But we'll talk more about that next week, okay? So we're up here in the pulmonary artery. We've got that blood that doesn't have oxygen in it. It's going to go through the lungs. It's going to pick up oxygen, and it's going to come back through the pulmonary veins into the left side of the heart. And the left side of the heart is going to be pumping, and it's going to push that oxygenated blood out through the aorta, to the arteries, to the arterioles, to those tissue capillaries. And in the capillaries, that's where it's going to unload, see, I'm sorry, backwards. We're going to unload that oxygen and pick up the waste. And then we're going to go back through the venules, through the veins, to the vena cava, and repeat. So this is a really good visual for you if this is what you're thinking of is the steps. All right, so aorta and arteries, where in the world are they and where do they go in the human body? Well, you have arteries all over the place. If you think about it, you need to take the oxygenated blood everywhere, up into your brain, all the way down to your feet and out to your hands, and throughout the central part of your body to get to the organs. So you have lots and lots of arteries. If you've ever heard of someone having their femoral artery cut and them hemorrhaging, possibly to death, that is a main artery and it's pushing a lot of blood down. And so that's why it's so serious if someone has a nick or a tear or a cut to their femoral artery. And really the same way too, if you're talking about axillary artery, your carotid artery, I mean, these are big things. Have you ever heard of an abdominal aortic aneurysm? There's an aneurysm that develops around this abdominal aortic branch. That can be really serious. If that bursts, that can cause death because there's an awful lot of blood that's involved with that. All right, so moving on. Anatomical structures of the heart include the superior vena cava, inferior vena cava, right atrium, tricuspid valve, right ventricle, pulmonary valve, pulmonary artery, pulmonary veins, left atrium, mitral valve, left ventricle, aortic valve, and aorta. Lots there. All right, so what are these major valves and what do they do? The tricuspid valve is between the right atrium and the right ventricle. And the reason why it's called cusp, or it has the word cusp in it, those are the flaps of the valve that open and close. Pulmonary valve is between the right ventricle and the pulmonary artery. The mitral valve is between the left atrium and left ventricle. And then the aortic valve is between the left atrium and aorta. And hopefully, yes, we have a visual to help us with this. Okay, and you can see where these valves are located, how they are helping control the movement of the blood so that it's being pushed in the right direction. It's not flooding back in where it came from, because as the heart pushes blood to the lungs, it has more that need to come in after it. And so if you have a bad pulmonary valve that's not pushing that blood, closing up and pushing that blood into the pulmonary artery and letting some of it flow back, you're going to have issues. And the same thing in some of these other places. Heartbeat. What is your heartbeat? There are two phases to it. There's diastole, which is the relaxation part, and then there's systole, which is the contraction part. Your cardiac cycle occurs between 70 to 80 times per minute normally, which means 100,000 times a day your heart is contracting and relaxing. It's no wonder they think of your heart as this big muscle that is a workhorse, because it is doing so much work constantly. The heart pumps 3 ounces of blood with each contraction. This means about 5 quarts are pumped per minute, 75 gallons an hour, or about 2,000 gallons a day. Can you imagine? Your heart is pumping 2,000 gallons of blood a day. Think of how much oxygenation then is taking place and how that's all going out and happening real time in your body around the clock to make sure that your cells have the nutrients they need and that the wastes are taken away and disposed of properly. Amazing when you think about it. So what can you tell from the heartbeat? What about the heart sounds? You have closure of valves, and you have when a murmur is heard, when something's not going the way that it should. Okay? These are phases of the heartbeat, and they show you what's happening. When is the tricuspid open, and when is it closed and the pulmonary valve is open, versus when is the mitral valve open on the right side, and when is it closed, so that the aortic valve can open and push that blood out into the body. All right, so you may want to try and work this out as to what's happening. What's closed at the same time, what's open at the same time, and what's happening. You have an SA node, a sinoatrial node, and it is the pacemaker of your heart. If you've ever heard of someone who's gotten a pacemaker placed in them, it's because their SA node is not working or not working the way that it should. And so they need an electronic device called a pacemaker that can provide that service. And the pacemaker part of it is the electrical impulse causing those walls to contract and force the blood from the atria into the ventricles. Okay? So AV node, this sends the excitation wave to a bundle of specialized fibers called the bundle of His, H-I-S, or the atrioventricular bundle. And the bundle of His, only one S when you spell it, remember. It sounds like two S's, sounds like you're hissing like a snake, but it's only one S when you spell it. This helps form that conduction microfibers that extend to the ventricle walls and stimulate them to contract, beginning systole, and then you have a short rest period. And then the pacemaker begins the wave again. So you've got the wave, and that is going to stimulate the bundle of His, and that is going to stimulate the ventricle walls to contract. Then you rest. And an ECG or EKG, that's an electrocardiogram, that is what they measure the electrical changes in the heart muscle as the heart beats. Last week we studied the nervous system, and we talked about an EEG that measures the electrical changes and impulses going through the brain. Well, this is the same version, but a different test. This specifically, I think I can get it out there, measures what's happening in the heart. So what does an EKG or an ECG look like? What is one of the, you'll notice if you've ever seen one of those reports that there are many frames. There's probably, I don't know, 10, 12, 15 frames that they can watch what is happening with the heart's electricity. They have named what's happening these waves and segments. You have a P wave, and that's where that is coming over the atria just before the contraction. You have the QRS wave, which is going through the ventricles, causing the ventricles to contract. Then you have the T wave, and that's where everything is resting. And so the example that they give you here is about a heart attack or an AMI, acute myocardial infarction. And one type of those acute myocardial infarctions is called a STEMI, because there's an elevation in the ST segment of the EKG. So that ST elevation is also known as a STEMI. All right. And so this just gives us a picture of it. And another picture. Blood pressure. Have you had your blood pressure taken? I think most of us have. It is measuring the force that the blood exerts on the arterial walls. And that is used using blood pressure measure or a sphygmomanometer. And it is expressed as a fraction. It's the systolic pressure over the diastolic pressure. So what is that pressure when the contraction is occurring over the pressure when it's relaxed? And that's what they're looking for. And they typically take it over the brachial artery, trying to catch it that way. So vocabulary: aorta, apex of the heart; arteriole, artery; arterioventricular bundle, or that bundle of His; with only one S when you spell it. Atrioventricular node, or that AV node, which is your internal pacemaker, not an exterior one. Atrium, the plural is atria. Capillary, carbon dioxide, coronary arteries, deoxygenated blood. Diastole, electrocardiogram, endocardium, endothelium. Mitral valve, murmur, myocardium, normal sinus rhythm. Oxygen, pacemaker, which is your SA node again, your sinoatrial node. Pericardium, pulmonary artery. Pulmonary circulation, pulmonary valve, pulmonary vein. Pulse, septum, plural is septa, sinoatrial node or SA node. Sphygmomanometer. Thankfully, hopefully, you will never be asked to actually use this. Blood pressure cuff is pretty much the common term that is used in medicine, thankfully. Systemic circulation, systole, tricuspid valve, valve, and vein. Oh, a few more. Vena cava or vena cavae, vena cavae. Ventricle and venial. Now we get to combining forms. And our equation is a root plus a combining vowel equals a combining form. So we have angio, aorto, artero, arterio, notice the two for artery, athero, atrio, brachio, cardio, cholesterolo, corono, cyano, mixo, oxo, pericardio, phlebo, sphygmo, stetho, thrombo, valvulo, valvo, see two for valve, and here are two for vessel, vaso and vasculo. Two for vein, veno and veni. Notice the I there. I for us is a very unusual combining vowel, so watch out for that. Ventriculo, ventriculo. The double-layered membrane surrounding the heart is what? You may have to go back to a few slides to find this. What is around, surrounding the heart? Okay, think of that. Contraction phase of a heartbeat. What's happening when it's contracting? And that should help you with that one. All right, what can go wrong with the heart? Well, you can have arrhythmias. You can have arrhythmias due to heart block, an AV block. You can have flutter or fibrillation. Sometimes they can reverse these chemically through using some medications and whatnot, and sometimes, which is called cardioversion, and other times they have to do it as a procedure, and that actually has some equipment involved, and that also can be called a cardioversion. There are congenital heart diseases, those that develop before someone is born, and that is the coarctation of the aorta, patent ductus arteriosus, septal defects, and tetralogy of Fayot. These are all things that happen when the heart is developing before the baby is born. And they have come up with quite a few fixes. They are surgical procedures, obviously, but they have come up with quite a few over the years. So these are no longer fatal diseases in newborns. Congestive heart disease or congestive heart failure. This is very, very, very common in the United States. It's usually because of high blood pressure and coronary artery disease. It results in pulmonary edema. You have fluid backing up into the lungs, and it is fatal if it's untreated. What it is that your heart is not able to pump the required amount of blood. And it can be due to like a number of things, and it can progress in a number of stages. So you could have coronary artery disease, which is caused by atherosclerosis. It can be because of an occlusion, a thrombotic occlusion, which has to do with clots. It can be due to ischemia, which is the lack of blood flow, necrosis, which is a death of tissue, or infarction, which is that heart attack. That infarction can happen in a number of ways. There's also something called acute coronary syndrome, where someone has unstable angina, which is heart pain, or a myocardial infarction. There are drug therapies for coronary artery disease, and they involve nitrates or nitroglycerin. If you've ever heard of somebody saying, I need to take my nitro, and they put it underneath their tongue, that's nitroglycerin. It dissolves under the tongue. Aspirin, beta blockers, ACE inhibitors, calcium channel blockers, and statins. And based on the type of coronary artery disease or how it's manifesting itself is usually what combination of drugs that are prescribed. There are also surgical therapies for CAD. There are percutaneous coronary interventions, if you've ever heard of stenting, where they can go in and put a stent, like a drug-eluting stent, or where they just go in and do angioplasty and clean the artery out. If the artery is so occluded that they cannot do some type of percutaneous coronary intervention or stenting, they may have to do what's called a CABG, coronary artery bypass grafting, where they actually go in, they pull a vein, usually out of the person's leg, and they use that to create this graft, this bypass graft, so that the artery, the vein can be used as an artery, and it can bypass the one that's occluded and actually fulfill the function. And those are very common procedures today. Although they are done pretty much at major medical centers, they are not unusual by any stretch of the imagination. Some people can sometimes have 3, 4, or even 5 bypass grafts done. Just depends on how severe their CAD is. Other problems that can happen with the heart, you can have what's called endocarditis, which is the growth of vegetations. That's not good. Hypertensive heart disease, again due to that hypertension, high blood pressure. Mitral valve prolapse, you can have something, the mitral valve, where it's prolapsing, it's not doing its job, it's not staying firm, opening and closing, and that sort of thing. Heart murmur, pericarditis, inflammation of the pericardium. Rheumatic heart disease. Scarlet fever is something that's treated by antibiotics, but prior to the use of antibiotics, strep throat. Let me go back. Strep throat. We have all heard of strep throat. Strep throat is treated with antibiotics. If you don't take antibiotics, or if they fail, your strep throat can progress to scarlet fever, which can cause rheumatic heart disease. And in that case, then it affects different parts of the heart, and you can research all of that. But that's why the advent of antibiotics was so important for strep throat, because it stopped almost every patient from going directly into scarlet fever and having rheumatic heart disease. And you may find that someone who is very, very old who had strep throat prior to antibiotics wide use may have developed scarlet fever and could have rheumatic heart disease from that. It may also unfortunately happen to those in a developing country who could not get antibiotics. What can go wrong with blood vessels? Well, aneurysm. We talked about that a little bit earlier with an abdominal aortic aneurysm, where that essentially it suddenly balloons and then it can burst. There's something called deep vein thrombosis, DVT. You may have heard of someone who got a DVT in their leg. they had some kind of a clot develop in their vein, and that causes issues. The clot can break off and travel up to the lungs and cause a pulmonary emboli or embolus. Embolus if it's singular, emboli if it's plural, and that can cause major issues. And the clots can go on from there. It's not it's not a good situation to have a clot roaming free in your body because it can end up. Um, we talked about in the last chapter, chapter 10, about the nervous system and about strokes or cerebrovascular accidents that can be caused by a thrombosis or a thrombotic event. Hypertension, high blood pressure, peripheral vascular disease. This can happen where the blood is not flowing to and from all the way down through the legs primarily the way that it should, which can cause some necrosis and some other tissue damage. Raynaud's disease, those cold fingers and toes. Varicose veins, all things that you can look in your book for more information on, or you can research if you want to Google. Which arrhythmia refers to rapid, random, inefficient, and irregular contractions of the atria and ventricles, getting up to 350 beats or more per minute? Well, it's definitely not C because Brady means slow. So I'll leave you to figure out if a flutter or a fibrillation is worse. I think it should be easy to tell. All right, lab tests. There's something called a BNP test, cardiobiomarkers, lipid test profile, lipoprotein electrophoresis. Those are all lab tests that can be ordered to study cardiac enzymes or cardiac activity and things like that. There are definitely diagnostic imaging tests that are used, everything from x-rays to ultrasound to CT, MRI, all of those types of things. Also, nuclear medicine is heavily involved in cardiology. There's what's called nuclear cardiology, where they're using radioisotopes to scan to see what's going on with the heart. And of course, PET scans. Cardiac catheterization, I referred to that earlier with that percutaneous intervention, coronary intervention, where you go in, usually through the groin region, in through the artery there, and go up to the heart. When you do cardiac catheterization, you can just look around to see what's going on. You could do stenting, where you could just do mechanical stenting, inserting a stent. You can put in a drug-eluting stent, which releases a drug over time to help with whatever the issue is with the artery. Then, of course, there's ECGs, EKGs, where they're measuring the electrical activity of what's going on with the heart. There's Holter monitors, which usually last 24 to 48 hours, and they're measuring the activity of the heart as well. Stress tests, sometimes with thallium, without, they can do those. So with nuclear medicine or without. Cardioversion, we talked about that, which is also known as defibrillation, which should help you with that question a few slides ago. Fibrillation is definitely much worse than flutter. So you can start out with what's called chemical cardioversion, using different drugs to try and convert the heart rate or heartbeat, that type of thing, the pacemaker, so to speak. And if that doesn't work, you can actually do a procedure you can use that with electrical to change the pulse of the heart. Endarterectomy is just what it sounds like. Extracorporeal circulation, sometimes this is done when they're doing cabbages or heart transplants to keep the circulation going if they have to stop the heart or do something significant with the heart. We talked about heart transplantation. There is that capability, and it has been around for a long time. Thrombolytic therapy, that's where someone has clotting issues. Either they're usually clotting too much. If you've ever heard of factor V Leiden, it's a clotting disease, and it can cause the blood to clot way too much. And so a thrombolytic therapy might be heparin or warfarin, or there are some newer ones that are out there as well. Transcatheter aortic valve replacement is another procedure. And this gives us a view of what they're doing with a cabbage. And I talked a little bit about this earlier. I'd forgotten this slide was there, sorry. But essentially, a section of vein is removed from the leg, and it's anastomosed to a cardiac coronary artery to bypass the area of blockage. And sometimes they do use a mammary artery to a coronary artery to bypass blockage as well. So it just depends on how they're doing it. This is the percutaneous coronary intervention that I talked about, that the stenting happens. This just shows you a stent that is not drug-eluting, just a plain old stent where they're trying to open that artery back up. And they leave the stent in there so that it can keep the artery open. And like I said, some have a coating with medication, a specific drug on it. Others are just the stent itself. Abbreviations. Oh, there are lots. When you get to the cardiovascular system, there are so many. So here we go. Pages and pages. And of course, you have all of these slides available to you if you want to print them out or make notes. So I'll move through here a little bit quickly. And let's see here. What else? Okay, so which procedure involves insertion of a balloon-tipped catheter into a coronary artery? We just talked about this. It absolutely is not a coronary artery bypass graft, so it's not a cabbage. I'll give you that one. All right, so our combining forms. Remember our equation. It is a root plus a combining vowel to equal our combining form. Aneurysmo, angio, aorto, arterio. See, there's two for artery. Athero, atrio, axillo, brachio, cardio, cholesterol, corono, cyano, ischo, myo, mixo, oxo, pericardio, phlebo, pulmono, rhythmo. Look at that, rhythmo. And watch out for that RRH combination again, as well as the YTHM. Sphygmo, stetho, thrombo, valvulo, valvo. Two for valve. Now here are two for vessel. Vaso and vasculo. Veno and veni for vein. And watch out for that I. Ventriculo. Now we have some suffixes. Constriction means narrowing. Dilation, and that's the widening, stretching, expanding. Emia, graphy, lysis, megaly. I think we've had all of those before. Meter, oma, osis, plasty, sclerosis, and stenosis. Make sure you know the difference between sclerosis, which is hardening, and stenosis, which is tightening or narrowing. Tomy. And now we have prefixes. A and an, Brady, which is slow. D, dis, endo, hyper. Hypo. Inter, peri, tachy is fast. So tachy is fast, Brady is slow. Tetra and tri. Those are for numbers. And that is it for the cardiology chapter. Yay, we have done it. Lots to study this week. So wish you a good week 7, and we will be back next week for week 8 to talk respiratory system. Take care.